If you are an adolescent with pain and swelling just below the kneecap, pain during intense sports activities, and difficulty kneeling on the ground, you probably have Osgood Schlatter disease. It is a very common disorder in adolescents. Although it is a self-resolving disorder, if the physician's recommendations are not followed, it can cause conditions that require surgery in adult ages. In this video, I will explain Osgood Schlatter disease. Don't worry, the treatment is not so complicated. Hello, I am Dr. Gürkan. I am an orthopedic surgeon. In this video, I will explain Osgood Schlatter disease and what to do for the treatment. In this disease, the traction force of the tendon that attaches to the upper end of the shin bone injures the weak growth cartilage during the rapid growth period. Let me explain why. The body's strongest muscle is the quadriceps on the front of the thigh. This muscle attaches to the kneecap, which we call the patella, in the front of the knee. It enables our body to move up and down the stairs, and carries the whole body upwards when jumping. The force generated by quadriceps muscle contraction is transmitted first to the patella, and then to the shin bone via the patellar tendon below it. Most of a child's longitudinal growth occurs from the growth plates at the ends of the long bones. Growth continues very slowly until the onset of puberty. Rapid growth begins at the age of 10 for girls, and the age of 12 for boys. In this period, the growth cartilage is very active and weak because it cannot fully mature during the rapid growth period. Moreover, the body weight of the child increases rapidly during this period. Counting on these factors, if the adolescent has a very active sports life, you can imagine how much load this growth cartilage carries and how it is injured. In this late childhood and early adolescence period, a painful protruding swelling may occur in front of the knee, under the kneecap, for those who attend intensive sports that require sudden jumping movements. These sports are generally football, basketball, and volleyball. These teenagers experience pain in the front of the knee while running, jumping, and climbing stairs. It is nearly impossible to kneel on your knees, and it is very painful. The incidence in adolescent athletes has been reported as 21%. On the other hand, it is seen at a very high rate of 4.5% in young people who do not have an active sports life. Apart from height and weight, shortness and stiffness of the quadriceps muscle, that is, the muscles in the front of the thigh, or hamstring muscles, that is, in the back of the thigh, have been suggested as risk factors. I'll explain why this is important in the treatment section. The most common ages are 12 to 15 for boys, and 10 to 13 for girls. These ages are the rapid growth period of adolescence. For those who do intense sports, these ages can go down to 8 years for girls and 10 years for boys. In the past, it was believed to be more common in young boys. Nowadays, as girls accompany more sports activities, the distinction between boys and girls gradually decreases. I want to inform you that the incidence of Osgood Schlatter has reduced considerably during the COVID-19 isolation period, as many people did not attend sports activities. In the physical examination, swelling can be noticed, and the patient feels pain in the front of the knee when applying pressure with a finger on the attachment of the patellar tendon. With this clinical presentation, the diagnosis can be made easily. However, the physician may wish to take X-rays or perform additional radiological examinations, even if all findings indicate Osgood Schlatter disease. The purpose is to avoid a situation that will show similar complaints, such as an infection or a tumor. These diseases are not so frequent, but the purpose is not to allow an irreversible condition when it is late to diagnose these serious problems. The first line of treatment is to take a break from all kinds of sports that can increase the pain. In particular, jumping sports such as football and basketball are avoided. Nowadays, many adolescents have great expectations for the future in professional sports careers. Naturally, the most crucial concern of these young people is how long they should take a break from sports. In a publication of 2019, 68% of 151 athletes could return to sports in 3 months, 79% in 6 months, and 81% in 1 year. This period is much shorter for those who do not do high-intensity sports. However, it is beneficial for them not to attend sports activities for at least 6 months. For most teenagers, staying away from sports during this time will be enough. On the other hand, for an athlete interested in active sports or planning to have a professional sports career in the future, it is essential to return to sports at an earlier period. It would be appropriate to give physical therapy and exercise programs to lengthen these young athletes' quadriceps and hamstring muscles. Still, it would be too optimistic to think the process will be completed in 3 months. Although painkillers are recommended during painful periods, there is never enough pain to use an oral painkiller. No medicine is entirely beneficial for anterior knee pain while doing sports or squatting. Taking a painkiller for pain and continuing sports is a fault. Remember that pain is a protective mechanism. There is no evidence of the benefit of knee braces, and there is no need to use them. With a break from sports, 90% of the discomfort resolves independently. If sports are continued despite the pain and swelling, a small piece of cartilage is separated from the growth plate in front of the knee. It remains as an ossicle at the bone-tendon junction in adult life. In such a case, it can cause pain in squatting and during intense exercises in the later stages of life. This separate bone piece inside the tendon can be removed surgically if needed. If it is not removed, the discomfort will continue. Otherwise, it is not a condition that will cause any disability. In this video, I explained a prevalent problem in young adults. Remember to subscribe and press the like button for support so that you can see my videos with orthopedics, nutrition, and sports content. May you have active days where you always smile and do not experience health problems.